Dr. Berman. I'm meeting this lady actually for the first time in person today, but we did a virtual consult. And what she's going to do, today we're going to do the lower abdomen, the upper abdomen. I haven't prepped her or draped her. I've just marked 4 little tiny incisions. They're only about 2 millimeters to 3 millimeters. One's going to be here, 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 and here. And what I'm doing is just numbing up with a very, very tiny needle, a little tiny bit of local. It'll make it completely numb, so I make a little incision. So this is the first part, and then very shortly after this, I'll prep her, and you'll see there'll be a bunch of drapes on her, and then I'll show you the next stage. But she's very comfortable. It's done under local with just some oral sedation. We do this all the time. In fact, this is my second SmartLipo case today already. This is the second part. As you saw previously, I numbed up the 4 areas. I've made a very tiny incision. I slip in the cannula, and then what I'm doing now is I'm infiltrating the area that I'm going to be working on, which is her upper and lower abdomen, which is the local anesthetic. And it's a slow, gentle process. And it's got a nice mixture of lidocaine, marcaine, epinephrine, bicarb. And this cocktail will make it completely numb. So this is the second stage, and then we'll go on to the third part shortly. This is the next part. So you can see her belly's much fuller because I've put lots of local anesthetic. It's a little bit lighter in color. That's from the epinephrine effect. The blue marks are my lines. This is the fiber optic laser fiber. You can see the guide light underneath my hand. And what I'm going to do now is move it back and forth in the fatty area. And as you can hear, there's a little clicking sound. That's the laser firing multiple times a second. She's completely comfortable. She's awake. I've given her a little pill to make her nice and relaxed, but she's awake and is comfortable. And I'll be doing this for quite some time. And then I'm going to switch over to the liposuction, which I will show you shortly. Now is I've been lasering her abdominal area, the upper and lower abdomen, towards the flanks. This is a blunt tip, what's called Mercedes cannula. It's got 3 holes, got a blunt tip, so it's very safe. And I've done over 1,200 of these. It goes in the incision. I move it gently back and forth, so there's no rough movements. And you'll see fat will come out the cannula. And it just takes little bits at a time, so it's a very slow process, but a very gentle process. And I'll be doing this quite some time. And then at the very end, we'll close the incision with the single dissolving suture. And she'll go home, take a nap, and then tomorrow she'll be back at work. She might be a little bit sore, but it really won't be terrible. Very few patients need much more than 1 or 2 pills of narcotics, and many patients don't take anything. Completed the procedure for today. She's got 4 little incisions, 1, 2, 3, 4. They're very tiny. I put a single dissolving suture in the wound. And then at the end, we'll put a little Steri-Strip, which is basically Scotch tape for doctors. And then she'll put on a pair of Spanx or spandex. She can shower tomorrow. She'll go back to work tomorrow. I want her off walking. And she can return to full exercising in 5 days. Today, because she's had the Ativan, she can't drive and needs to just relax. But she'll be basically back to normal tomorrow. And that's essentially it. Great, by the way. It's nice chatting with you. It's important to know that she'll keep getting better and better for 6 months. There's no magic. I always encourage my patient to get stricter, particularly with their dieting, because if you drop your body fat, you're going to enhance the results I give you, and of course, if you put on weight, you'll detract from it. So I always speak to them about the diet that I recommend, and that's up on my website as well.